Mammalian ventilation is ventilation of the lungs, more specifically of the alveoli. Now remember that your lungs exist within your thoracic cavity. And we have, let's do just sort of our lungs like this. And our lungs are anchored to the wall of the thoracic cavity by the pleura, right? That's the serous membrane that surrounds the lungs. So as we sort of look at how this works, we have to remember that as a mammal, you have a muscle that separates the thoracic cavity from the abdominopelvic cavity, and that muscle is the diaphragm. Right? And the lungs are sort of anchored to that diaphragm, like so. Now, as we inhale, what's going to happen is that diaphragm is going to flatten, and when that happens, those lungs get pulled down and they sort of expand. And when they expand, they are going to increase their volume. And as we increase volume, that leads to a decrease in pressure. Now remember that you are standing outside, right? Or inside of your living room. And you have air that surrounds you, and that air has a pressure associated with it. That is the atmospheric pressure. So as long as the pressure inside of the lungs, so we'll say P lungs, is less than the atmospheric pressure, we get inhalation, because the air will follow its pressure gradient. It will move from the high pressure in the atmosphere to the low pressure inside of the lungs. So if we want to exhale, right, we just lift that diaphragm back up and sort of reverse the process. Now, imagine that you are standing down here at sea level. So we'll just draw the sea. And you are standing right here. And somebody else is standing at the top of Mount Everest. Right? Notice that they are at atmospheric level, and the pressure at sea level, the atmospheric pressure at sea level, is about 760 millimeters of mercury. The atmospheric pressure at the top of, let's say, Mount Everest is 250 millimeters of mercury. Okay? So one of multiple problems that breathing at the top of Mount Everest that appears is the fact that look how low I have to get my pressure inside of my lungs even to cause that inhalation. Here, what do I have to get pressure inside of my lungs to? 759 millimeters of mercury. Here, I have to drop it all the way down to 249 millimeters of mercury if I want to inhale. That is quite the feat. Right? So that's one of the problems of breathing at high altitudes. We'll talk about some more in a later video.